Last several weeks, I've had a few patients that have come from outside clinics, been operated on elsewhere, and they're dissatisfied. They had abdominoplasty elsewhere, and their belly button looks scarred and malpositioned. They have a wide scar in their abdomen, facelift result that doesn't look like what they expected. So how do we avoid these complications? Really meticulous, precise surgery, taking your time. Don't leave the operating room until it looks as good as you possibly can get it. And then I think before you go to surgery, having a good game plan, having run through the case in your mind. As a young surgeon, those things are what I used to teach the residents and the trainees. Really thinking about the steps of the operation so that way you feel really comfortable, and then it just feels like a dress rehearsal in the operating room. I think that the most important thing is before we get to the operating room, so the planning, the analysis, the discussion with the patient about complications, the risks of surgery, expectations, and that there's no guarantees in surgery. So if those patients had been talked to about those things with their surgeon, and their surgeon had a complication or came up a little short, I think those patients would be a little bit more understanding, a little less dissatisfied, because they would have felt there was transparency in that discussion. So I try to start our relationship with a transparent discussion of the risks, the benefits, and the expected outcomes. I would implore my patients when they go for consultations, ask the office, what's your policy on refunds? What's your policy on revisions? Who pays? Does the patient pay for a revision? Does the office offer a discount for a revision? Our office has a policy. Those policies are in place because revisions can happen. Dissatisfaction of an outcome could happen. If somebody has a poor scar result, I want to make them happy. If it's my scar, I want to revise it, often more than the patient wants to revise it, because it's my work. I want them to be proud of it, just like I'm proud of it. So if you have a wide scar that has not healed perfectly, talk to your surgeon, see what they can do to make it better. And if you're still left guessing, really think back to your first interactions with that surgeon, because I think that that's where we, as teachers in the consultation and as surgeons who hold a lot of the information about what could happen, really have to express to our patients so they understand as much as they can to make an informed decision of these risks. There's no guarantees in surgery, but seek out a board certified plastic surgeon, find someone you trust, and I hope to see you soon. Take care. Bye-bye.